I'm Dr. Samantha Durland and welcome back. I'm super excited to talk for Cleopatra, a woman's website geared towards women's health. So today we're going to talk about hot flashes. What's a hot flash? So a hot flash oftentimes is a sensation that you're going to have from the fluctuation of estrogen levels in your body. We can feel hot flashes when we've had a baby. We can feel hot flashes in pregnancy because we're having lots of hormonal shifts. So I do remember having them then, and then I have not had them again until my 40s. And they can be brought on by stress. They can also be brought on by exercise. They can be brought on by, the hormonal shifts like we talked about. So they can be elicited by various causes, but they're very common around this perimenopausal time when we're having shifts of hormone levels, and we can also feel like our periods are a little bit off as well. Now, also know that some people go through menopause sooner than others, so some people can actually have hot flashes in their 30s, some even in their 20s. And they're just these really big waves of feeling hot from the inside out. And you can get very sweaty, your face looks red, your hair can get wet. Hot flashes can make you irritable because it's fatiguing for the human body to have to endure those ups and downs. It also makes it hard to sleep, and you wake up frequently. And when you don't sleep and you wake up frequently, it also makes us more irritable. But a hot flash can be varied for various people. So I have some patients that feel like they have cold flashes. I have other few people that feel they have hot flashes. So as I'm talking in this realm, don't feel like you have to have a certain way of having one to actually qualify for one. You'll know what they are. So there's various treatments for hot flashes. Conventionally, you can treat them with some medication, such as SSRIs like Lexapro, you may have heard of, Celexa, those types of medications. You can also use Effexor. Neurontin is another medication that some people will try. And basically when I think of those medications, I think that what they're doing is they're kind of tricking your brain so they don't see that the hot flash is actually happening, but they're not actually making your hormonal shifts any less. So another approach would be there's herbal remedies. There's things like black cohosh, there's evening primrose oil, you can try some DHEA. Some of these agents also can reduce hot flashes and have been very effective for some patients. There's also bioidentical hormones and hormone therapy, and that is actually directly treating the hot flash at its cause. So you're not having these ups and downs. It's actually preventing you from hitting a valley. And when you prevent the valley of hormonal kind of deprivation, you can prevent your hot flash. So in a nutshell, hot flashes can be a burden to many women. Some women say they breeze through menopause without hot flashes. If you're a gal that's breezed through menopause without hot flashes, awesome. Some people do great with herbs, other people need medicine, other people need hormones. And as you look at these, I just encourage people not to pass judgment on anyone else, not to believe you have to be anyone else, because what works for your neighbor, what worked for your mom, what worked for your sister, and what works for you may be different. They're all just tools. There's not a better tool, there's not a wrong tool, they're just tools. And if you're using a tool that's not working, don't feel bad about your body. Don't be upset with your body. It's just not engineered to have that be effective for it then. It doesn't mean it can't be effective for it later. It's just right now you need relief of your symptoms. And feeling like forcing a tool to work well for you and being frustrated that it's not working is just causing you to have more hot flashes. So reach in the old tool bag and find a tool that's effective. Relieve yourself of your symptoms, educate yourself, and work forward from that moment. And know that what you use at different stages of life can vary. It's as easy as clicking below to see what products are available in the Cleopatra store. It's also as easy as clicking below to reach out to a telehealth provider that can talk to you about some help with the symptoms that you're having. And certainly if you don't feel like you want to journey in the products that the website sells, just please reach out to somebody to help you because it's really real to feel alone, and you just certainly don't have to feel that way. So thanks for tuning in, and we'll talk to you next time.